Chair for Kenya Union of Clinical Officers, also the Chair of the Health Union Caucus. And today we are here at the KEMU School of Clinical Medicine with a meeting with our students and also with the clinical officers in the Meru County. And we have been able to discuss several issues. Of course, we were here today for the induction of the clinical medicine students, and especially those who are about to graduate and get into the field. But even as we do that, of course, we are looking at the salient issues that are affecting the profession. And we are very happy that we can see now in the county of Meru, the county government of Meru now has a stable government with the coming of the new governor. And we are happy, and we want to assure him that we are ready to collaborate and partner so that we can be able to make health of this county better for the betterment of the citizenry of the Meru County. We know there are a few things that had stalled, being the promotions, some of the recruitments that were supposed to be done. But I want to assure the governor and tell him that the health workers of Meru fully embrace him, and they are very hopeful that now with the new regime that we are going to see these matters being brought into fruition. I must also talk about the controversy that there is with the Social Health Authority. And as Kenya Union of Clinical Officers, we continue to call for immediate and urgent intervention to ensure that the operations at the Social Health Authority continue without a glitch. And in saying that, we are boldly and clearly saying that we have identified the problem in the Social Health Authority. And the problem is with the people who are heading, especially the chair and the CEO. And we continue to call on Parliament that if then the CS cannot be able to replace these people, the Parliament should censure them and remove them from those offices. And we do not say this because we hate them. We have no personal issue with Dr. Abdi, who is the chair, or with Mr. Ingasira, who is the CEO. Some of them are actually acquaintances. We actually talk. But we are saying things for the benefit of Kenyans, because the Social Health Authority was supposed to be an enabler for the universal health coverage. But universal health coverage is not just a term. It means that Kenyans everywhere where they are, they must be able to access health services. Those health services must be of good quality. And when they access health services of good quality, they must not suffer from financial catastrophes. The reason as to why we are calling for the censure is because for almost 1 year, we have a law that really guides well. But the people who have been given the mantle to ensure that they implement UHC through the Social Health Authority, they are making policies that are denying Kenyans the very access that UHC is supposed to guarantee by denying clinical officers to do procedures, to register facilities, refusing to empanel them, even after there is an agreement from the highest offices on the land. And we met the Deputy President last week, and the Deputy President ordered that by the next day, all the clinical officers should be empaneled, should be allowed to do their procedures. As we are standing here, we do not even have 50% of the clinical officers empaneled. And that is why we are saying that the chair and the CEO of the Social Health Authority, they have individually and jointly contravened the rights of Kenyans. The right under Article 43 to access the health services. The right under Article 27 about discrimination, because by discriminating clinical officers, they discriminate that citizen from Meru, from Maua, who is getting that service from that clinical officer. They have also fallen short of Article 47, which talks about fair administrative procedures, by going against the law. And as sum of all that, it means they do not meet the Chapter 6 requirement about ethics and responsibility of leadership. And that is why we are saying we must be able to replace them, and we must get people of goodwill, people with capacity, who can be able to move the agenda of UHC forward, and without discrimination to anyone, not to clinic officers, not to nurses, and not to any healthcare worker, because discrimination to any of the cadres that provide healthcare then means that Kenyans are going to suffer. The services that they offer, they are not going to get. It limits their access, and it also delays our vision to achieve the universal health coverage.
The national government needs to support the county's government. We have a new governor here in Meru County, whom we are hopeful that he is going to correct and ensure that he addresses all the issues that have been bedeviling the Department of Health here in Meru County. One of them, it is shortage of health workers, which includes the shortage of clinic officers. It is our expectation that they shall be employed. But it is unfortunate the national government has failed to remit the monies to the counties since the month of December. Kwa hivyo tukiwa hapa tunasema ya kwamba serikali kuu ambayo imeongozwa na William Ruto na kijana wetu Profesa Kithure Kindiki, tafadhali wacha tuweze kuachilia pesa ambazo zinastahili kuja pale kwa county, ndiposa hawa madaktari ambao tuko nao hapa wakiachiliwa waweze kupata ajira ambayo kila mwananchi anapoenda shuleni anatarajia kupata ajira. Another thing I want to say that SHA was a good idea, but it is that time the government looks at the teething problems so that we ensure that every citizen that is down there that requires services is able to get those services. SHA is about ensuring every Kenyan gets that service. But the moment you find that you are paying for SHA, you are contributing to SHA, but you are not able to get that service, the government needs to act swiftly to ensure that every citizen anapata ile huduma ambayo anastahili.
And for the last 1 year, we have over 5,000 interns who are out here who cannot further their education, no, they cannot practice what they have learned for the last 4 years also, because the ministry is reluctant to post them. We are due for our internship. We are qualified people, but now the ministry is going against the internship policy, which stipulates that within 60 days we should be posted. As we speak right now, on Tuesday we had a demonstration in Nairobi, but until today on Friday, the ministry hasn't responded to the issues that we raised. And our take is that today, as after the deliberation that we had, is that we shall continue engaging them. We shall continue reminding them to do their work. We shall continue knocking that half house until the time when we shall be posted. Remember that for the last 1 year, we have our interns who are now into suicidal thoughts. We have our interns who are now into depression. We have our interns who have been, who have despaired with life, getting themselves into drug abuse. And it's time for us to have long-term solutions, because we can't continue being on the streets. It's time for us to be where we really belong, the hospitals. And we have full confidence in the new PS, Dr. Homo Olunga, who was appointed yesterday. He has gone through what we've gone through. Let him remind the CS what should be done, because if we can neglect the most vulnerable people of our profession, then indeed we don't have a profession. Ideally, we were supposed to be posted last year, July. But the ministry claimed that it doesn't have sufficient funds to post us, all of us. So since last year, July, until today, we've been out here waiting for the posting. And now the ministry claims that the earliest it can post is in July, and going against the previous regulations that we've been getting. And that's why we're saying that we can no longer wait anymore. We need to be posted right now, and let us belong to the places that you are supposed to be. Those are the hospitals, not at home, not at the streets.
Profession. Welcome to the clinical medicine profession. Tuwapigie makofi jamani.
Thank you very much.
For the photo, muangalie huku kwingine venye mtu wa picha ataweza kuona.
Beneza, congratulations and welcome to clinical.
Thank you, Brian. Welcome to the clinical medicine profession.
A little face.
Okay, it's okay.
Let me elaborate. You might be asked that question. How have you this time? And we'll start with the stadion. Same lectures, same units.
Count of 3, 1, 2, 3, semeni chapo. Nice one. Haya tena. Nice one. Sasa